Are you being misled in a way that is letting you down when you look at your results in comparison to somebody else? I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with thousands of patients, ultimately helping them transform their health. And through that, there's a lot of different stories, and the path is different for every single person that we see, right? And that is no different from you. And one of the things that I see on a regular basis is expectations that are just they're unrealistic for what you're going to see, I guess, for lack of better terms. And I know that this has been something that a lot of people are aware of, right? You go on social media and you see the people that, they're standing in front of a rented jet, or they're standing in front of a rented sports car or a rented mansion, or whatever it may be. They're leading their lives in a way that's not congruent with what their actual life is, right? They're trying to give that portrayal of more success, of more progress, of more whatever. And the healthcare industry is not impervious to that, right? It happens in the healthcare industry just like everything else. And when you get on those things and you look and you see that somebody is having miraculous results, sometimes that does happen, but that's the exception. It's not the rule, right? For most people, that is not the case. And it's very frustrating for me, not because, I people come in with whatever expectations they have, right? And what my goal is to help people understand the process. And when I do a good job of that, then the expectations are what the expectations are, right? Is if I can converse with them in a way that they understand what I'm trying to say, they know that in most cases it is going to take time to make that result, right? And the big reason for this is what we see is a lot of people are saying, all right, well, I shouldn't have to change my lifestyle in any way, shape, or form, and I'm going to see the progress that I want to see. And that's unrealistic, right? Because the things that we do on a daily basis are what leads us to where we currently are. And in some cases, that may be our nutrition. That may be the lack of sleep that a lot of people are having. That may be the lack of motion that people are having, or the excess motion that is repetitive in certain ways for factory workers and different people like that. It may be the overbearing stress that we're all accustomed to at all times, right? And we all have to face those things, because ultimately when any of those things get out of line, when they are not working in the way that they should be, we get inflammation. And inflammation over time is going to lead to change in tissue, right? We don't see any of those processes until there's a little bit of damage done. As that damage starts to spiral, we see more and more. So we start seeing other things like changes in sleep sometimes, because the inflammation and that stress can lead to changes in sleep or stress levels, or other issues like that, anxiety or depression or whatever it may be for each different person. But it's an individual journey. We have to have all of that working correctly. So what is going to work for you, the path that you need to go, is not like anybody that's on social media. You have your own special path. And that doesn't mean that you shouldn't follow this stuff. Enjoy the content. Learn what you can learn from those things. But don't expect everything to be exactly the same. There's a lot of people out there that, I'll use a chiropractic example. They're like, okay, this person is, this kid that is autistic and hasn't ever talked, he's going to talk right here. What do you know? We worked on them and they spoke. I knew it was coming. In most cases, that's not something where it's just spontaneous, right? It's something that they either set it up in a way that it was going to happen. They edit it, or whatever it may be. That's not realistic. But it's also the same for medicine, right? When we look at all the prescription medication commercials out there, don't ever change your lifestyle. Just adjust this one symptom and you're going to lose 1,000 pounds and be perfect. You're going to be the happiest person on the planet. It's unrealistic. It happens in all forms, in all professions. But we have to look at the foundational principles of health. We have to change those things. And when we don't see progress. And I was listening to some interesting stuff here, and you might laugh at me because I am a nerd. Okay, I was listening to some chiropractic speeches from the 1960s, and ultimately what they were talking about is the first chiropractic clinic, like the first college. What the guy would do is he would bring people into a home. He bought a big house where he could bring about 40 people in, and it wasn't just coming in and getting adjustments, right? He had control of what they were going to eat. He got them out and got them moving. He got them sunshine. He got them, community where everybody was working together for a common goal. And when we have all of those things, when we have the foundational elements of health, we have all of the things that are going to be necessary to build that foundation that we can build up from. And it doesn't mean that you make that change right now and you start living by principled things for 1 week that you're going to be there. You're building the foundation. The results still have to take place. But if you come back in 3 months after living that and you haven't had a change, then I'm going to be shocked, because after a few months, we are totally different people, right? Our cells have that time to kind of replace themselves. They get rid of those unhealthy cells and replace them with new, healthier cells. So we start moving in that place where we stop making as much inflammation. And as we get that inflammation out, we slow that damaging process, that degeneration process, and we start to grow, we start to build, and we start to see a profound change in our health. And that may show up as better mental health. That may show up as better heart health. That show up maybe better strength, maybe better sleep. It's going to be different for each person depending on who they are, depending on where they started, and depending on what they wanted. But there is a lot of research out there and it says chiropractic does not work. And that may be weird that I'm sharing this with you, but those things that it's ridiculous what they're using in them, right? They're saying, hey, we used 2 adjustments on this and we tested 6 months later to see if there was any lasting change. It's not realistic, right? If somebody is going to go and exercise 2 times and 6 months down the road, you're going to check to see if they're in shape without them doing any exercise in between, it's not going to work. There's a lot of things that are set up to fail. So it's rampant in research. It's rampant on social media. It's rampant in so many things. And you have to be able to see through that BS to actually get to that next stage. So I hope that this helps you. Like I said, if you enjoy the content, by all means, continue to watch, continue to learn, continue to expand your mind, because a lot of times when you're seeing those things, it actually gets you excited about making the change, right? So it keeps you on path in that way. When you're around other people that are healthy, it's easier to make those food choices. It's easier to make those exercise choices. It's easier to do the things that you need to do to get healthy because you're around that at all times. It's always there. But don't sit there and compare what you are looking at on the screen to what your actual results are going to be. Because if you do that, you're going to be disappointed every single time. And when you're disappointed in things like this, you don't make the things that are actually going to lead to lasting changes. So I hope that this helps. Obviously, if you have any questions or need anything on this, reach out to me. I mean, we're here to help you however we can. So reach out. As always, I appreciate you spending the time and attention. I know those are your greatest resources. I appreciate you spending some of that with me, and I will look forward to catching you on next week's video.